Now, Jenifer, will you allow me to reflect on what I'm hearing is going on with you right now? So in the past, we've talked about that you've been successful at transitioning from maybe a problematic drinker to a very controlled drinker with just the 2 drinks per occasion. That so far you haven't completely quit smoking. You've had several times when you've relapsed. And now there's a lot of new things happening. You lost your job, which I'm very sorry about that. You've had the new pain, the post-operative pain from the surgery, and the new information, the new pain in the hip, and you're facing another hip replacement sometime in the near future. You're building up a tolerance to the pain medicine, and you're living it alone, so there's no one around at home necessarily. So you've told me a lot of things that are red flags for the possibility of having some extra challenges with drug dependence or increased alcohol use. Is that okay that I'm talking about this right now?
It's fine, because I mean that all makes sense to me. And the smoking one's really interesting, because I've had 1 cigarette since this was done. But part of the reason for not having just, I can't actually do that. So I don't know whether I'll go back to smoking or not. I have no idea at this point.
So you know that my job is to reflect what I read from the literature, from the science and the studies of what puts people in a position of facing a relapse. And that my job is to help you avoid that relapse. So would it be all right if we continue on talking about what we might do to prevent that?
If I get too uncomfortable, I'll withdraw.
Well, some of the ideas that I'm thinking are, there's certain specialists out there that are dually trained in managing pain in people with a history that have faced substance problems. And it may become necessary or advisable that you're being seen by someone like that, because it sounds like your orthopedist isn't very knowledgeable about what to do when you need more pain relief.
I have a suspicion that orthopedics deal with both. They don't know much more. Well, yeah, depends. Some may, some not. Don't know.
So how would you feel if it came to the point where you would benefit from seeing someone like that? How would you feel about that?
If you're talking about someone like that, what sort of someone are you talking about?
Well, I know of a specialist, and I've sent patients before and felt very confident. The patients came back to me really liking him. He's dually trained in addiction medicine and in pain management. So he understands a little bit better the needs of a person like you that's faced an alcohol problem in the past, and how to help you avoid that, yet help you feel pain-free.
I'd be open to that. Yeah, because anything to keep the pain under control without making it difficult on the other side of finding that my tolerance, I can't find what I want to say.
Can I help you?
I don't know. Try.
Well, tolerance is the step right before dependence. So I think I'm hearing you say that you certainly don't want to get dependent on an opiate or a morphine type drug. And that could, no one wants to get dependent on them. And you're actually more knowledgeable than many and maybe seeing it coming. But you know, once you're in that state, your mind is changed and you lose control of the mind by that.
Yes.
Is that right? Am I hearing you correctly?
Yes, that's it. Yeah, I am conscious that I could become dependent on opiates.
And I would like to remain on your side to avoid that, help you find ways to avoid that and be pain-free. Okay.
Anything to be pain-free will be lovely.
We all deserve to be pain-free.